Well, 2 years ago, when the coronavirus sent people into intensive care, they were often the only thing between life and death. I'm talking about nurses. The pandemic, it may be ending, but the plight of these essential men and women, it is not. Today, in parts of the UK, nurses staged an unprecedented strike. It's the first time that the Royal College of Nurses trade union has called a strike in its 106-year history. Up to 100,000 nurses walked off the job on Thursday. They say that this is a last resort in their fight for better wages and better working conditions. Union leaders say that nurses are overworked due to short staffing, and that's exacerbated by a backlog of appointments and treatments made worse by the coronavirus pandemic. Here's the head of the nurses union, followed by the British health minister.
I would love to say I was in negotiations with the government. They're refusing to negotiate with me. They bring me into a room, they tell me I can talk about anything but pay, they close their books, don't put an extra brown penny on the table, and they walk away and they turn their back on the profession.
Well, we have an independent process that looks at these issues in the round, that looks at the pressure for many viewers faced with higher taxes, faced with cost of living pressures, and balances those with the needs of our NHS as well. And that independent pay review looks at these issues, and we have accepted their recommendations in full.
I'm joined now by Howard Catton. He is the CEO of the International Council of Nurses. He joins me from Geneva. Mr. Catton, it's good to have you on the show. You know, I want to ask you, we reported so much on the nurses in the UK when the pandemic started, the worst phase of the pandemic, and it was the nurses who were the essential workers that people were praising. They were a godsend to many people. How is it possible that in the span of 2 years we go from that to 100,000 nurses striking because they can't even get a proper pay increase?
Good evening. This is an issue in the UK. It's a global issue. We have seen during this year from the summer an increase in disputes and in strike action right the way around the world. And there are some striking similarities in terms of what's led us to this point. We have had a historic undervaluing of the nursing profession right the way around the world. We hear the words of care, of compassion, of a vocation, but that's almost been an excuse not to pay nurses fairly and properly. As you say, the pandemic then comes along and everybody sees the true value of nurses and nursing care, holding our communities, holding our societies together. We got on our doorsteps and we applaud the work that our nurses and our healthcare workers have done. But as we move on from the pandemic, that applause hasn't translated into any action. Quite the opposite. The UK are digging in. We're not even going to talk to the nursing leaders about pay. So that applause without action has led to understandable anger. But there's one other really important point that's at the heart of what the nurses in the UK are saying and around the world. This is a patient safety issue. We don't have enough nurses. We can't provide safe, high-quality healthcare services.
Well, you and your organization, the International Council of Nurses, you've written to the UK government. You're calling for more investment in healthcare. Are you saying if things continue the way they are, that going into a clinic, going into a hospital, if you're sick, you may be actually putting your life and your health in danger by doing that?
I think the shortages that we have in healthcare right now already present a risk to patient care. But the reason we wrote to the health minister in the UK is because we have this narrative, which is we can't afford to pay nurses. You know, we've got difficult economic times. We've got war in Europe. We pay nurses. Inflation is going to go up. This is wrong thinking. We need to flip 180 degrees how we look at healthcare, not as a cost, but as an investment. As I've said, when healthcare goes wrong, our societies, our communities start to crumble. But we also know when healthcare goes right, people are healthy, they work, they're productive. It's a driver for economic growth. And if we invest in health workers, in our healthcare systems, in the research and the innovation, we firmly believe that the road to economic growth is paved by investment in health. And that's the argument that we're trying to make to all governments around the world.
Yeah, and your argument, it's a valid one, but even in our program today, I'm reporting about a 16, 17-year-old player in Brazil who plays soccer, and he's now being transferred, for millions and millions of dollars. That speaks to the priorities our society has right now. Millions for soccer players, not millions for nurses. I wonder how you change that, because I think we're talking about something here that goes beyond appropriations and budgets.
I think you're right. I think there's a much deeper issue about how we value different workers and what's important to us as societies. The irony around these strikes is that just a few months ago, we were saying to our nurses and health workers, you are the most important people holding our societies together. But now we're saying to them that that if they're going to go on strike, we can't afford to pay you. We've got governments who are driven by, free market principles, the forces of supply and demand. But with 50,000 nursing vacancies in the UK, we think that we could be more than 10 million nurses short globally as well. Those free market principles would tell you that pay is part of how you recruit and retain. But health ministers, politicians are turning their back on that. Why is that? I think one of the reasons why that may be, I think there's a gender issue going on here as well. I think, my profession is 90% women, and the fact that, we're not looking at the hard economics, we're not looking at the health security and safety issues, we're not looking at the economic arguments for investing in health. Why are our politicians turning their back? I think part of that could be, as I say, because of the gender of the profession.
I think, too, unfortunately, we're out of time, Mr. Catton, but yeah, it's a valid argument. I think you could have this conversation talking about school teachers, talking about police officers, firefighters, people that we depend on, for the essentials, and for some reason, society doesn't want to pay them more than we know that they deserve. But unfortunately, we're out of time. Howard Catton with the International Council of Nurses, thank you. We appreciate your time tonight.
Thank you.